Women in western Wisconsin are left asking what's next after Aspirus announced that it will end OB/GYN services at their Medford location. News 9's Nick Robinson live in Wausau with why doctors are saying this will put a huge burden on them and how they are working to fix that problem.
For many women in the Medford area, that clinic was the only place they could go to deliver their babies. And starting in October, they'll have to make the hour-plus drive here to Aspirus Wausau. Aspirus recently announced that they would no longer be delivering babies at their Medford clinic starting October 1st, only offering prenatal and postnatal care at that point. Dr. Ryan Spencer at UW Health says that not only will the drive to Wausau waste precious time while a woman is in labor, but also cause problems for her and her child.
When patients don't have access to obstetric units in their local areas, we know that leads to increased complications for deliveries, and subsequently for those babies that are born, risk to them can be higher as well.
Aspirus Northwest Division President Dale Husted said the issue at the Medford Clinic revolves around staffing, saying in a statement in part, Aspirus Medford has been operating with only one part-time OB/GYN physician since November of 2020, which results in challenges providing coverage for on-call services 24/7, 365. We are not alone in this decision, as across the country, rural providers have made similar changes, with less than 40% of rural hospitals performing routine deliveries. The hospital said that it has been aggressively trying to recruit physicians in Medford, but that it was difficult to find ones willing to move to a rural area. Spencer said he's working on a solution for that by helping out with UW Health's Rural Obstetrics and Gynecology Residency Program. The program aims to send qualified physicians to areas that desperately need them.
Be a model for the rest of the country about how we train obstetricians to function and train in rural practice during the residency so that they have a comfort and a familiarity to be able to function and practice in rural areas.
He said that doing this will be their best way to keep services from stopping at other clinics in the future. Spencer told me that it's on lawmakers and hospitals to make sure that women in rural areas are taken care of and that they shouldn't have to drive several hours for care. Live in Wausau, Nick Robinson, News 9, WAOW.